Delhi has now recorded 3,235 new COVID cases in the past 24 hours. State Health Minister Satyendra Jain, though, has said there is no need for a reimposition of the lockdown. We have already gone past the peak of the third wave and cases would now be coming down. So for now, compulsory wearing of face masks and social distancing will suffice as a measure. But the central government today, in a meeting with the Delhi government, stepped in here on this crisis, also announced a 12-point COVID plan to tackle this situation. Meanwhile, at the front of air pollution, the Central Pollution Control Board says Delhi's pollution levels are higher this year, this Diwali, as compared to what was recorded last year. This also means because of stubble burning cases in neighboring states has gone up by at least 40% as compared to what was recorded last year. Before we throw this open to our experts and guests with us this evening, let's take our viewers through more figures that are coming in concerning Delhi. These are 95 COVID-19 fatalities that have been recorded in the past 24 hours. And this happens to be the third highest single-day death toll. At least 1,103 fatalities reported in the last fortnight. A total number of COVID deaths in Delhi have now reached the figure of 7,614. Total cases have touched 98,699 in only 2 weeks of November. Meanwhile, the Delhi Health Minister once again reiterating that the peak of the third wave is over. Most has been sorted so far. The worst is over. Our correspondent Ayushman is getting us further inputs here on what will largely change on ground. Ayushman, in that meeting that happened with the central government, between the central government and the Delhi state government here, what is going to change on ground? What are the new measures over and above what the Delhi government has already been taking on this?
Well, sir, before we move on to that, a significant point that has to be made out here is that for the first time in 4 months, we have seen about 30,000 cases nationally. And if you see the national scenario, Delhi comes at 2 points. One, at the significant contribution of the active cases beyond Kerala, it is at the second, after Kerala, it is at the second place. And in the fatality, it is at number 1. So Kerala and Delhi are going to be headache for the in the national scenario. Now, moving on to the point where what can be done on ground. Now, centre and Delhi government both know that given the situation right now, because of the pollution, festivities and winter, the cases of respiratory problems are going to increase, and that is why the focus is there on increasing the ICU beds. At the same time, the BiPAP machine are being to be given to the Delhi government. The private hospitals are going to be roped in. The Delhi government can only augment the health infrastructure, which is very much needed right now. Apart from that, if you see, the fatality is something that is worrying, and for that, the centre is saying that increased number of RT-PCR so that the case detection at the earliest can take place. If you remember yesterday's meeting, sir, specific guideline for increasing RT-PCR has been given, and it is expected that the testing would go up to 1 lakh or more than 1 lakh. But the primary input is that the augmentation of health infrastructure should take place. The doctors and nurses which are not there, the deficiency is there. The ex-servicemen and all those retired doctors are also to be roped in. The augmentation of medical health infrastructure in DRDO will take place. The ventilator facility will be given to the national capital. Given the current situation, the gravity of cases are going to increase, and as per that only, the government is trying to pitch upon an effort where at least the medical infrastructure is available to cope up with the rising number.
Okay. All right. Yes, these are valid points that you reiterated, Ayushman, to what has just been announced post this meeting between the central and the state Delhi government. Let's go across to our panelists. We have Ms. Atishi Marlena, national spokesperson of AAP and MLA AAP as well. Also, Dr. K Monga, chairperson of the IMA Hospital Board of India. First to you, Atishi, please. Thanks both of you for being with us this evening. Ms. Atishi Marlena, in the measures that have now been announced by the central government, to what extent this is only further going to be reinforcing the battle against COVID-19? The Delhi government, of course, has all along said that the maximum possible that is being done on their end to rein in the figures.
Sir, I think that it's very clear that Delhi is now seeing a third wave of COVID cases. And I think the thing about this wave of COVID cases is that because of the extreme air pollution, the severity of the cases is increasing because of that. And what are mild cases because of the pollution, as it is, there's an effect on people's respiratory health. Mild become moderate, moderate become severe. And we're seeing actually in terms of the infrastructure for dealing with this COVID crisis, the number of beds is adequate. Even today, the number of beds, 50% beds are available for patients. But the real bottleneck is as far as the ICU beds are concerned. And this is the reason why it was the Delhi government that initiated the meeting with the central government, because we believe that everyone needs to pool in their resources to actually be able to fight this battle. And since it was Delhi, we were finding that we are now running out of ICU beds. Almost 90% ICU beds were already occupied. This is the reason why we reached out to the Union Health Minister, reached out to the Union Home Minister, and asked for central support on this. And we are very hopeful. We are hopeful in the fact that now that both the governments are going to be working together. The last time also when the first wave of COVID happened, because of a collaborative approach of the central government, state government, and a lot of even of non-governmental organizations, we were able to deal with the peak. And I am hopeful that we would be able to do it again.
All right, Dr. Monga, are you satisfied with what you hear with respect to what your analysis of ground reality is as far as the availability of ICU units and bed in hospitals? Do you think healthcare staff was also an issue that has now been taken into account with the centre stepping in and ensuring that extra doctors, paramedical staff can be flown into Delhi, coming in from other states which are far less affected whenever required here?
Delhi is passing through a very critical time. And whatever, I mean, these politicians say, third phase, second phase, whatever it is, but it's a very bad phase. And you never know it. I mean, it's not predictable. This disease is not predictable at all. So we don't know how long it will go on, how many deaths will occur, because already Delhi has a positivity of around 15%. And deaths, you are already saying that's more than 90 for the last many days. And this winter, this pollution, these festivals, and I believe inappropriate behavior of the public during these times, they have all been contributing to it. And in a way, I can say that governments are clueless and the public is careless. And during these times, whatever steps, I mean, these two governments are going to take, they are welcome, they are positively good. But adding ventilators or ICU beds or BiPAPs, you need manpower to do it. And then you are talking about people will be taken from retired people and everybody. But on the other hand, you are saying that retired people or people around more than 60 years of age or 65 years of age, they are the vulnerable group. And most of them have COVID
Right, they're of the
comorbidities
vulnerable
also.
category. Yes.
Yes, you cannot engage all of them into a position which may take their lives also. So these are tricky situations, and on one side, whatever the government has done, they are welcome, but public is also to be blamed. Late arrival in hospitals by doctors, by patients, is a very critical situation because most of the people arrive in the hospital when it is pretty late. That is one of the causes of so many mortalities in Delhi in the last few days. And then some RT-PCR testing we have always been seeing. Hospital board has always maintained that RT-PCR should have been done much more from the very beginning. Now they are talking about it to increase RT-PCR. In fact, they have done it in the last 5-10 days also. But still, I believe it is inadequate. In Delhi, I just got a call from Dr. Hadgivar Hospital, somebody, that, I mean, there is a queue for rapid antigen test, which is not at all reliable. And for the RT-PCR, the report will come in 3 days. In those 3 days, people are on the street infecting others also. So RT-PCR should be done more and more, and same day reporting. I mean, they should definitely plan a way that they are able to give
Okay.
the report same day. These are the few
All
issues I
right.
think government need to be
Uh,
done.
Yes, we get your point, Dr. Monga. Let me please take across these issues that you've raised to Ms. Marlena. Ms. Marlena, two things here on this. One, of course, is more awareness. He's saying that people's behavior has also largely been very careless, but also in some measures that have been announced of flying in healthcare staff if there is a shortage. Is that really a workable solution on ground? And to keep saying that the peak of the third wave is already over. To what avail would you continue reiterating when you have Dr. Monga saying here that it's not over? You can't really say it's over. This is a very unpredictable situation right now.
Number one, I think that said, I think that no one can at any point of time with this disease say that it's over. At what point of time it's going to be over in Delhi or India across the world, we don't know. But our data analysis seems to show that we seem to be past the peak of the third wave. That is all that the health minister was saying. Having said that, we are still making preparations for the worst case scenario, and that is the reason why we reached out to the central government. The reason why we need more healthcare workers is actually two, I think. First of all, we have to realize that there is a lot of fatigue that healthcare workers are themselves going through. Having now been at the front line since March or April, a lot of healthcare workers have been through COVID themselves. There are definitely after effects of that. So, number one. And number two, because we need to increase the number of ICU beds, with every ICU beds, the number of healthcare workers, because it is intensive care. It's not just the machines or the ventilator, it is intensive care in terms of the kind of monitoring that patients require from doctors and nurses. And this is the reason why healthcare workers are needed as we are looking to expand ICU beds. And I agree with Dr. Monga, that is the reason why that the possibility of getting in retired doctors exists even from Delhi. But the central government and Delhi government have discussed and decided that we should get in healthcare workers, especially from paramilitary forces, etc., who might be posted in other parts of the country, precisely for the reason that one does not want to take in healthcare workers who are in the most vulnerable. So I think that, see, what we need to understand is that COVID is a disease that
Okay.
none of us fully understand. In fact, like you have, I was hearing the story before we started the debate. You have some of the largest pharma companies who are still trying, struggling, 90% efficacy,
Yes.
94% efficacy. We still don't know how far that day is. So I think that uh, for a
True.
pandemic like this that the world is seeing for the first time, uh, I don't think that any government, I think no one was prepared for it at all. I think citizens are also not prepared. I think there's a lot of fatigue in citizens also. I think the festival season has aggravated this because people now just want to get out of their homes. They want to meet people that they love. They want to meet their friends and family because they have not done it for months. And I think that we just all have to come together with greater awareness and
Okay.
take on this fight against.
Dr. Monga, in your view, to what extent are we looking at a situation in Delhi which requires a lockdown? This has been ruled out by the Delhi government already. The central government has several times in the past also stated that lockdown is no longer an option to be looking at yet another lockdown. Do you feel that the government also needs to address this concern because there are other European countries which have decided to come into a second round of lockdown with a second wave of COVID, but that's not going to happen here in India. Does that concern you?
Ma'am, I mean, we must know that, I mean, all said and done, next 3 months are going to be crucial. And I agree with Atishi on most of the points. But more important than
Okay.
having a lockdown, because lockdown in a small place, in a city, does not carry much of a value because there's so much of infiltration. People are going and coming back home. So many people are getting their employment, their livelihood, and everything is there. But on top of it, that may not be the final solution. We need to have strict compliance of mask and social distancing. which I think people are forgetting in Delhi nowadays because of maybe fatigue and festivals and the urge to meet each other. These may be the issues, but I think more and more challenge, more and more compliance, more and more strict, vigilance. These are the things which should be taken. In these festival days, people were around in thousands and lakhs in all the big markets. And even compliance on patakas and crackers in Delhi, it was really, I believe it was bad. I mean, people were doing it in large numbers also. A lot of pollution was there. So
Yes.
I think the government has to come up and say that, no more forgiveness on these issues. No mafi on mask, no mafi on social distancing. Anywhere, anybody doing it,
All right.
seal the
Well,
shop,
Dr.
to
Monga, we
tell
get
the
your
people.
point here. We'll have to leave it at that. Essentially, you're asking for the government to be stricter with people. Atishi, Marlena, Dr. Monga, appreciate you speaking with us here. And of course, a word of caution that's coming in from the doctor on our panel here, saying that the coming 3 months are going to be crucial. So we, on our own individual, personal level, need to be far more careful. If we haven't followed the rules and the SOPs and the guidelines for COVID-appropriate behavior, let's start doing that right now. Should have started yesterday than today. But let's start doing that. These are 3 crucial months, and we hope we can continue to fight the peak of the COVID third wave here in the national capital.